Hi, I'm Terry Vandekar, and I wrote my paper on adverse childhood experiences. Now, adverse childhood experiences was not a very common term until 1998, when Robert Anda and Vincent Felitti wrote their paper, The Relationship of Childhood Abuse and Household Dysfunction to Many of the Leading Causes of Death in Adults, an Adverse Childhood Experience. Prior to writing this paper, Vincent Felitti he founded the Department of Preventative Medicine at the Kaiser Permanente healthcare system in San Diego, California. He was running a weight loss class at the time, and he kept having people drop out, and he couldn't figure it out. So he started to survey people. He was asking them, he was trying to get to know them, to find out why these people who were actually being pretty successful in the program were dropping out. And he was asking them questions like, how much did you weigh at birth? And how much did you weigh when you graduated from high school? And he asked one woman, how much did you weigh the first time you had sexual intercourse? And she said, I weighed 40 pounds. It was my father. And he thought, okay, that was my second case of incest that I'll see in my medical career, statistically speaking. That's all I'll see. But that wasn't all he saw. And the more he talked to these folks in this weight loss program, the more people told him stories of sexual abuse as a child. A couple years later, he met Robert Anda, an epidemiologist from the CDC, and together they decided to study this on a wider scale. So they surveyed over 17,000 members of the Kaiser Permanente healthcare system in San Diego. These folks were 80% white and 10% black. 74% of them had some college. 46% of them were college graduates, and they had an average age of 57 years. This was middle America. This was my neighborhood, right? This wasn't some marginalized inner city slum. This wasn't Appalachia. This was the Midwest. And 46% of these folks reported events that would later be described as adverse childhood experiences. The more Felitti and Anda talked to these people, the more stories came out, the same things came out. And so in order to study the data, they organized the stories, these traumas, into 10 different categories. And they developed a scale from 0 to 10. So that if you experienced one of these categories as a child, you earned 1 point on the scale. If you experienced the category 100 times as a child, you still earned 1 point on the scale. So what does this mean? So what? Well, we're all aware of how stress biology works. It's well documented how stress affects your body. In the case of acute stress, lion jumps into the room, sympathetic nervous system kicks in, and prepares the body for fight, flight, or freeze, right? Whatever is going to ensure the safety, the survival of the organism. And then when the lion leaves, everything relaxes and you go back to homeostasis. But the problem is when stress is chronic, when it is pervasive or it is persistent, and the lion never leaves. And now you have your sympathetic nervous system never turns off, and you are constantly dumping glucocorticoids into your system, specifically cortisol. And the effect of this constant stress is well documented on adult nervous systems and adult immune systems, and it's actually pretty well documented on immature and developing immune systems and nervous systems. So children who suffer from chronic stress, they have changes in their amygdala and in their insula, which are the two areas that help to regulate emotional response and self-awareness. And their immune systems that are developing are also affected by this chronic stress, so that as adults, they display more immune markers in their blood than people who didn't experience ACEs. So how is this a public health burden? Well, Anda and Felitti found that there was a dose-dependent relationship between ACEs, the number of ACEs, your score, and your likelihood of engaging in a health risk behavior or of suffering from a chronic illness as an adult. So here's the dose-dependent relationship for smoking and COPD. The lower numbers are 0 ACEs, the tall number is 4 ACEs. That's the likelihood of engaging in smoking and of contracting COPD. But it doesn't stop here. This is not just it. It's also true for chronic depression and suicide attempts. And the odds that you will become a victim of rape increases with the number of ACEs that you experience as a child. Diabetes is a $254 billion burden that increases the risk of comorbidities, and you are more likely to contract diabetes the more ACEs you have. Unintended pregnancies and elective abortions. Serious job problems, unemployment, IV drug use. Your risk of cardiovascular disease, the #1 cause of death in America, and a $555 billion burden on the public health system increases the more ACEs you're exposed to. You're more likely to get an STD. There's 2 million of these a year. There are 45,000 smoking-related deaths every year, and it's a $300 billion a year burden. There are 88,000 alcohol-related deaths every year, and 46% of these folks will tell you a story of some kind of childhood trauma. Your chances of sexual promiscuity and your chances of contracting any kind of cancer increases the more ACEs you have. So what is the government doing about this? Well, honestly, they're not doing much because it's not their problem, right? Child abuse got some publicity, it got some support, and in 1974, the Childhood Abuse Prevention and Treatment Act was passed. But that's been pretty controversial. The Reagan administration tried to overturn that, and this is not generally considered to be the arena of federal public health. Federal public health, it has the responsibility of epidemics and natural disasters and incidences where the states just don't have jurisdiction. But the primary responsibility of assuring the public's health actually falls on the states. And some states have stepped up and implemented ACE-focused legislation. Alaska, California, Montana, Vermont, and New York all have, but the state of Washington wins the award. The state of Washington developed the Family Policy Council, which invested funds into county-level programs. These programs are community-based and community-run. They have the community is invested in them. The community has pride in them, and they feel responsibility for the outcomes, so that kind of community capacity develops and cements the relationship and it ensures the longevity of the program. They did a retrospective study from 1997 to 2006, and this community capacity model that the state of Washington implemented did have a good effect. It decreased the incidence of ACEs in children, and it helped the adults to resolve trauma from their ACEs. Now, the Family Policy Council was defunded in 2011, but the programs that it developed continue to thrive because of that community capacity. So what can we learn from this? Well, Ohio has a similar structure, public health structure, to the state of Washington, meaning that we're both decentralized. We have local public health. And the CDC advocates the use of the community capacity model as a catalyst for state and local programs like this, like the state of Washington has. So you know what? It would be really nice if someone in the state took an interest in ACEs and somebody injected some funds, and we were able to look into developing a program based on the one that has proven to be very successful in the state of Washington. In conclusion, child abuse extends way beyond childhood. The effects extend far beyond childhood. And the first step to helping this problem is awareness of it, because there's not a great awareness for it. Awareness will help to develop programs that can improve the health of 46% of the population that have a story of adverse childhood experiences. We can help 46% of the population live healthier and more productive lives by helping to address their adverse childhood experiences as adults.